Hello, this is Helen Cummins. Today I'm paying a visit to Dr Estrella Fernández, who runs a very successful aesthetic clinic in the centre of Palma. Dr Fernández is a specialist in oculoplastics surgery, specialising in the rejuvenation of the area around the eyes, as well as a range of other aesthetic treatments. Thank you for having us here today.
Thank you very much for coming.
Yes. So can you tell us a little bit about what you do?
What I do is the most important thing for me is helping people. As I have a very long way in medicine and aesthetic medicine and ophthalmic plastic surgery, I can do from the basics treatments to the most complex. And I can join my patient from the millennials, ages, to the older people, because in this way of the aging process, we can help patients from the beginning to the most complex treatment. Especially in millennials, it's very important for me to help them to do the prevention of the aging process, because we can detect in the exploration of the face cells of my patient how they are going to get older and which parts of their face are going to be elderly earlier than his natural age. And we can help them in this moment to do not have biggest problem in the aging natural process. Yeah.
So actually, if somebody comes earlier, younger, you can help them through their journey of aging and to do it in a good way.
Yeah, absolutely.
Who is typically your clients here?
Okay, I have several kinds of clients. There are young people who came more for natural lips because I don't like that my treatments can be seen. I like the most natural result for my patients. And then from these young people, I can, when they came to my office, I also advise them, okay, you want this, but this is your biggest problem in your face, and we should take care of this. Maybe not today, but in a couple of years, we have to think to prevent this area from the aging process. And then we have the medial aging patients, and usually they started to need some treatment to be more vital, more vitality, because they look tired or they look sad. And we can help them to change this in a natural way, because I like to restore the aging process anatomy to have the most natural result, not only in aesthetics, in function, because I like that the faces of my patient, the function of the facial of my patient works in the better way they can.
I have some friends and they ask me, can I recommend somebody? He said, doctor, but they seem to have a lot of fear. They're afraid, especially the first time that they come, and maybe they've never had any kinds of aesthetic treatments other than maybe facial. What would you say to people like that are a little bit afraid to take that first step?
Yeah, it's absolutely normal to be afraid. For me, in the place, I feel the same. But I think that when you have most of patients, when they came to my office, they have been thinking in a little problem or something that they disturbed to them for at least 2 years. So if a long way, and they are a day would say, okay, I have to do something to fix this. And they decide to go to my office. And they don't know how much we can help them to feel better and to look better, and to prevent the aging process of their face. So I think that you have to know where to go, to have what you are really looking for. And I think that, okay, I can offer them my experience, my
qualifications that you're...
I'm looking for the excellence from ever. Even when I was studying in the college, was looking for the excellence in everything I have done. And that's what can offer them, my experience and my way to take care of
I think it's very important also to say your philosophy is very much about enhancing and just making a little bit better what the person has. It's not that you're going to change how they look, or you don't want that result. You just want to make them more radiant, maybe look fresher, younger, more vital, right?
Yes. Another thing that is very important for me is, my philosophy is to help people to look how they feel. Because sometimes they are someone in the 40s or in 50s and they say, okay, I look tired, but I don't feel tired. Everybody in my office asks me, did you sleep well? Yes, I did, but I feel tired. And there's nothing that you can do against it. Because in the genetical aging process of your face, they are going to have some changes, little by little, that they are going to make you look tired or sad, even if you are not. And I love to help people to look how they feel, to recover the anatomy of the aging process, and to help them to look fresher, more attractive, younger. And that's very, very important.
That's exciting, to help people to kind of reflect how they actually feel inside, that radiates through them. That's really
Yeah. And another very important thing for me is to help my patients how their face look for others, because our brain as humans read faces, and you say, okay, this is a kind person, or this is a bad person, or this is a non-trustable person. Why? Because we are reading faces, and we can change this emotional facial appearance, and we can help people to look more softer, kinder, happier, and that will help them in their relationships with others.
That's a good question. So, what would you recommend for me? What would you? We've talked before about my eyes. I mean, genetically, I have quite a lot of retention of water, which bothers me sometimes. So, what would you recommend?
Okay, at this moment for you, I don't recommend surgery. I have a lot of patients who came to my office like you with this kind of eyelids. I have to say to you that I love this kind of eyelids. It's a fullness eyelid. And that makes an almond look of the eyes. So it's very, very kind, and it's very, very trustable look. But when I recommend my patients to do a surgery is when the heavy eyelid goes over the eyelashes, and even when my patient needs to raise the eyebrow to keep the heavy eyelid in position. This is the moment for surgery. Before this, we can help patient with open the look with maybe with some Botox treatment or some structural treatment for the ligament of the eyebrow, and that will open the look of the eyes, and that will helps to keep better the heavy eyelid. For you especially, as you have a lot of water retention in your eyelid, I recommend you to do a ganglionar lymphatic drainage of your face every day, especially in the morning and at night. And also to use cold patch for your eyelid. I have a small tutorial in YouTube when I explain how to do the facial drainage system, and it's very, very helpful. In 3 minutes, you can take a lot of water from your face.
Oh, that would be great to know. I think it's great that what you're doing, and I love the fact that it's natural, that you work with patients to actually bring out the best of what they have themselves.
Yeah.
So thank you very much.
Thank you very much for coming. It was absolutely a pleasure to have you here and to help you with your small little problem on your eyelids. That they are amazing by the moment.
Okay, thank you.
Thank you. Thank you very much.